So this was a study that we did in collaboration with University Hospital Basel. We accessed a cohort of samples that consisted of disease state controls. These were patients that were symptomatic controls, neuroinflammatory disease, or other neurodegenerative diseases. In addition, we had a cohort of samples that consisted of MS patients. So these were patients who had been diagnosed with CIS, relapsing remitting MS, SPMS, and primary progressive MS. We used the MSDA panel to evaluate associations of individual biomarkers to classify these different disease states and to classify the different subtypes of MS from one another. So we looked at association of individual biomarkers to classify symptomatic controls versus MS patients, to classify neurodegenerative disease versus MS, and all the different subtypes of MS that I mentioned earlier. So we looked at relapsing remitting versus progressive MS, and what we found is that there's promising signal from the proteomic biomarkers that we've identified for disease activity to also classify patients based on their disease state or their subtype of MS. I think there's many benefits a test like this could bring to clinical practice of MS. First, it's very important that we are able to establish MS as it might compare to other related diseases or conditions. So the ability to distinguish patients who have other neurodegenerative diseases versus MS or neuroinflammatory conditions versus MS could bring a great deal of value to the clinic. In addition, being able to subtype patients biologically based on their proteomic signatures can have very important implications on the treatments that those patients might be prescribed. Furthermore, being able to predict if a patient is going to be a progressive patient, secondary progressive or primary progressive, versus relapsing remitting can also have very important implications for how that patient is managed and treated.